Cases of Vibrio are popping up along the coast. The Centers for Disease Control and Prevention says coastal states like Mississippi are the most vulnerable. Will Polston spoke with a doctor about what to look for and how to avoid infection.
Vibrio, a flesh-eating bacteria, is popping up yet again, with more than 30 cases reported this year in states along the Gulf of America. It pops up every year as the waters get warmer.
I wouldn't say it's the most common bacteria, but it is going to be the most concerning, the most deadly bacteria that we as a coastal city are gonna see.
Only one case has been reported in Mississippi this year so far, but there's always a risk. Dr. Brett Kathman with Memorial Health System suggests immunocompromised people and those with open wounds to avoid the water. Not doing so could lead to a potentially deadly infection.
If you're noticing a redness streaking up and down your affected extremity, if you are experiencing fevers, chills, anything that you really can't explain otherwise except that that wound looks and feels infected, then I would absolutely seek medical care as soon as possible.
Now, this is one of the treatment options. This is a hyperbaric chamber. Now, this chamber changes oxygen levels and pressures to help cure your wounds if you ever contract a bacterial infection.
Vibrio is always present in Gulf waters, but Dr. Kathman says that you can still enjoy the summer fun with precautions.
But if you're going to get into the water, make sure that you check that you don't have an open wound. And again, if you're in one of these at-risk populations, then I would avoid getting into the water.
The CDC says Vibrio can also be contracted through contaminated seafood, especially raw oysters. More than 50,000 cases come from exposure to contaminated seafood every year. In Harrison County, Will Polston, WLOX News Now.
The CDC says Vibrio can be found most frequently from May through October.